Mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community.
Bipolar disorder is a mood disorder that causes extreme mood swings that include emotional highs and lows. It is important to be aware of these signs and symptoms, or this could be you or a loved one. Bipolar disorder has two phases. Signs in the manic phase include extreme happiness, irritability, poor concentration, and increased energy. Signs in the depressive phase include feelings of hopelessness, loss of energy, and loss of interest and pleasure.
Some symptoms of the manic phase include excitement, paranoia, and agitation. In the depressive phase, suicidal thoughts, sadness, and trouble concentrating.
How is it diagnosed? Patient history, family history, psychological examination, and mood charting.
How is it treated? Medications, day treatment programs, hospitalization.
The 4 P's referring to mental health first aid are preserve life, prevent the problem from becoming more serious, promote recovery, provide comfort and support.
It is important to know the difference between a mental health challenge and a mental health disorder.
A mental health disorder is characterized by a clinically significant disturbance in an individual's cognition, emotional regulation, or behavior.
Mental health challenges are temporary daily life stresses that can be caused by bad grades, sports, and friendships. The ALGE method is a step-by-step action plan used to support someone who may be experiencing a distressing situation. The first step is to assess for risk of suicide or harm.
Reagan, are you okay? I noticed you haven't been yourself recently. I've noticed you experiencing lots of mental highs and lows.
I'm fine. Sometimes I just feel really happy and then the next I feel really sad.
Have you ever considered harming yourself or suicide?
No, I just feel like I'm not in control anymore.
The second step is to listen non-judgmentally.
Tell me more about your feelings.
I just feel that like school, sports, and friends have been really tiring lately and I don't know how to keep up with that.
That does sound really stressful.
The third step is to give information.
It is normal to feel overwhelmed and anxious sometimes. 20% of people our age suffer from mental health challenges. 46% of Americans at some point in their life will meet the criteria to have a diagnosed mental health condition. Nearly 1 billion people have a mental health disorder. 1 in 7 of ages 10 through 19 experience a mental health disorder. The number of visits to a physician's office with the primary diagnosis being a mental health disorder is 57.2.
The fourth step is to encourage appropriate professional help.
Reagan, have you ever considered seeking professional help?
No, I don't want to be seen as being crazy.
You're not crazy. Stigma regarding mental health prevents people from seeking the help they need.
What is a stigma?
Stigma is a mark of disgrace associated with a specific circumstance, quality, or a person. Often people with a mental health condition or disorder are seen as weak, crazy, or dramatic, but this is not true. We can destigmatize mental health by normalizing going to therapists, talking about it, and raising awareness.
The fifth step is to encourage self-help.
It is important to do things for yourself to relax and de-stress.
What can I do?
You could listen to music, work out, or go on nature walks. If you are ever feeling hopeless and you need someone to talk to, the suicide hotline number is 1-800-273-8255. And 3 Culver resources could be Pastor Brenda, Deacon Mike, and Dr. Boyce. Know that it's okay to ask for help.
It's okay to ask for help.
Don't be afraid to ask for help.
There's no shame in asking for help.
It's okay to ask for help.
Don't be afraid to ask for help.
There's no shame in asking for help.